This is Dr. Nancy Zentis. Welcome to the OD Doctor. And today we have the privilege of having our dear friend, Dr. Bill Moskal, with us to talk to us about current trends in the healthcare field. So I'm sure you'll all be really interested to hear more about what is going on in healthcare. Before we get started, I just wanted to introduce myself. I'm the CEO and founder of the Institute of Organization Development, and we provide online OD certification programs for those people that are seeking career opportunities in the field of OD. We've been doing this for about 24 years, and we're excited to be a part of the OD community. So Bill is, I'd like you to also know a little bit about Bill. He is not only has been an OD consultant since the mid-70s, and specializes in the healthcare field, but he also is a really great facilitator of our OD certification programs with the Institute of OD. So I'm excited to have you meet Bill and have him tell us a little bit about what he knows about some of the challenges that the healthcare industry is facing.
Good. Thank you, Nancy. Appreciate it. Good morning, everyone. Look forward to this. This is kind of exciting to, be able to share with you some of the ideas and challenges in organization development in healthcare. And as Nancy said, I've been around the block for a little while here in healthcare, especially started off in the late 70s in the hospital system. And after that was on my own as a sole proprietor and also part of a organization providing OD services and quote unquote products to healthcare, and not just hospitals, but the healthcare industry in general. And as we all know, healthcare is changing quite a bit. So it's interesting. When I started off in healthcare as a vice president of OD at Henry Ford Hospital in Detroit, OD reference in healthcare was focused more on overdose. So to be honest with you, there were a couple of people in the healthcare first couple of weeks I met with people. They really thought I was a physician dealing with people with drug overdoses. And I had to explain, because back in the 70s, even a definition of organization development was difficult to get a handle on, especially in healthcare. But when I started off in healthcare, it was kind of interesting that back in the late 70s and early 80s, OD was really focused on a lot of workshops and training because it was part of the sell in order to get people comfortable with what OD was. They didn't understand the definition of being a planned process, working through a change management and engaging people and investing them in the change itself in healthcare. And then back in the 90s, it started moving more into a strategic initiative with kind of a focus on CQI, continuous quality improvement. And it's interesting to note that that's kind of taken full circle again. And CQI has become kind of an initiative, again, being embraced by healthcare. And then back in the early 2000s, it focused more on evidence-based organizational performance, because at that point in time, healthcare was going through a lot of changes. There were mergers and acquisitions that were just beginning to take hold. And then in the mid 2000s, and also now, as we all know, that the technological changes have had a real impact on healthcare. So from an OD perspective, it's gone from kind of a workshop training silo into a very involved initiative, part of the strategic planning process with the organization. But as Nancy had asked, to try to address some of the OD challenges in healthcare, one of the things, and I don't like to compare it to non-healthcare, but you can't help but do that because the organizations are somewhat different, but yet the same in some respects. Both organizations, non-healthcare and healthcare, are made up of people, and that's the greatest asset. But the focus of a challenge focus for OD professionals in healthcare is knowing that the number one focus is patient care, safety, and quality. That's really one of the key initiatives. It's not a product necessarily, even though at some point in time, people at the administrative level would like you to focus on product and processes. but in reality, it's that relationship building that's really critical. One of the other things that's a challenge for OD professionals in healthcare is all of the regulatory compliances that come into place. There's regulations coming in from the federal level, from the state level, and needless to say, coming in from a lot of the insurances, both insurances that we buy on a personal level, or Medicare and Medicaid, and also some of the larger companies like United and Blue Cross and so forth. There are a lot of compliance issues and a lot of technicalities. And why is that important for an OD professional in healthcare? Because dealing with the complex changes and challenges that the physicians and the non-physicians, who needless to say are in a dual leadership relationship, and that really needs to be emphasized from an OD perspective. As you work in a healthcare organization, when you think of leadership, you have to think of dyads. You have to think of the physician group and the non-physician group as working together to help get through some of these challenges. The other thing, too, to note in healthcare that is more prominent for an OD practitioner to be wrapping their arms around is the fact that it's an interdisciplinary approach. The care of a patient is not just a silo necessarily, even though some of the teams tend to be silos, but it's not just the physician that provides that care. It's also the nurse, it's also people who clean the room, it's also the anesthesiologist, it's also the blood drawers, it's also the people who provide the dietaries, trays and so forth. And transport, there's just so many dynamics in terms of a team approach. It's interdisciplinary. So dealing with an issue that a team has, it really has a domino effect. You can't just deal with an issue without realizing it's going to have an impact on a half a dozen other teams that are separate entities within the organization. Another challenge, and this is the one that really stands out for me in healthcare versus non-healthcare, is healthcare people, and in large healthcare organizations, there could be as many as 90 different allegiances. Physicians, nurses, other practitioners, housekeepers, maintenance people, elevator operators, phlebotomists, et cetera, all belong to associations, not necessarily unions, but they belong to associations that provide them with their certifications and the foundations for the work that they do. These have an impact on how an OD person works with the teams, because you have to keep in mind that in healthcare, you think in terms of the profession, however you define it, has an allegiance to their association first, and an affiliation with the organization second. Whereas you take a look at non-healthcare organizations, there tends to be allegiance to the organization, i.e. IBM, AT&T, Ford, Exxon, whatever it might be. But there is also, they have associate or affiliations with some of their professions too, but it's not as intense and integral to the process. Because if you think about it, a nurse is a nurse no matter where he or she works. It doesn't matter what their affiliation is. They're a nurse first, okay? Same thing would be with physicians. The other thing that's a challenge for OD professionals in healthcare is the fact that working with the number one asset, namely the people, is the high turnover rates. It's tough to get consistency in any kind of intervention, because the turnover rates can be as high as 10 to 15 to 20% in some areas. And as we all know, during the pandemic, we are all aware of it, not just in healthcare, but all through the United States and the world too, is the burnout rates were extremely high for the people who were delivering direct care. In some cases, they were losing as many as 20, 30% of the people. And in fact, many of the nurses that I'm familiar with, and I live in Florida, ended up becoming travel nurses, even though they worked within the organization that they're currently working in. It's a complex thing. We don't have the time to explain how that worked, but they were able to take, quote unquote, the time off so they could get through some of their renewal efforts on their own and save their own lives while they're dealing with the high stress levels of the COVID patients and all the other related pandemic issues and instances. So why is that important for OD professionals? Knowing that you may be working with an intact team, and by the next week, in working with some team development efforts, you may have lost 10 of the 100 people that you were working with or more. The other thing that's a challenge for OD professionals in healthcare is working with administration for ensuring that there's a better rate of retention, the recruitment, the retention of the professionals and the not quote unquote non-professionals, the support and the foundation for the organization. It's very costly in any company to have to replace someone. To replace someone in healthcare is extremely costly. It could be as much as $60,000, $70,000, $80,000, $90,000 to replace a nurse. And that also doesn't include the downtime of a new nurse, a new physician, a new phlebotomist, whatever it might be, coming into the system, learning the new system. So it's a very costly process. So part of the OD initiative, working strategically with top management, is to ensure that you're helping them understand the complexity and the importance of retention, recruitment and retention in the organization.
Bill, I wanted just to ask you another question, and that is, could you tell us a little bit about how would the OD function be structured in a healthcare industry in your experience?
Yeah, and it's been interesting because I'd say if you went into 5 different organizations, you might have 5 different constructs. And it probably depends upon the sophistication and the initiative of what's happening strategically. The more recent one I just worked in, it was part of, I worked in as a consultant. The OD was part of the HR function. However, by the time we completed our intervention, our project with that particular company, OD became a parallel department to HR, with HR having talent development and the traditional HR products underlined, and the OD was strictly, by the time we left, was strictly focused on change management and talent redemption, not redemption, but team redemption, they called it. And what they meant by that was ensuring that the new clinics and the new teams that were working together were tied together interdisciplinary around the same mission, vision, and so forth. So that was one example. Some of the larger organizations like the HCAs and Attendants of the World and Summit and so forth have a very sophisticated and more traditional OD model, where the OD is part of the strategic planning process, and it's actually a division within that process that actually focuses strictly on, as we know it, on OD, change management, and other initiatives around talent development and talent renewal. So that's one model too. But I'd say out of all the 5 organizations I could cite right now, the model is different. The good news is the model is usually driven by what the vision and the mission is of the organization. But I think the challenge for OD people is to get top management and leadership more invested in how OD can really make a positive impact on what's needed for that company to move forward, especially with all the technological changes going on.
Can you give us an example of how OD can make an impact on a healthcare organization?
Yeah, I can. I'm thinking of one. In fact, I was speaking with a colleague the other day, and we were reminiscing about a intervention at a hospital with about 2,500 people in the Midwest. And he was the vice president of HR, and I was there for probably 3 or 4 years working on an OD initiative. It was a hospital that was on the brink of closing. There was another hospital in the city itself, and it was a competitive hospital. The one we were working with was a faith-based hospital. The other one was a community hospital. The faith-based hospital was just on the brink of closing. Their turnover rate was in the 28% for nurses and higher for some of the other areas. They were losing people to the competitor. a new CEO came in with a driven initiative, and that was not to close the hospital. That was a performance outcome, and the other one was to make this a thriving organization, not just surviving, but a thriving organization. And we initiated, from an OD perspective, a long-term process called 5 years. And within 5 years, we set this goal about what we wanted at the end of that. And there were a couple of things in place, such as at the end of 5 years, he wanted all 2,500 people to be somehow invested and engaged in the OD process of change. And what happened was there were some traditional workshops and training to develop the skill levels of the people within the organization. Technology was brought in to ensure that people could be skilled up in Epic and some of the other areas that were necessary for data collection. And the key thing, though, was to bring in nursing and leadership. Nursing in almost all healthcare organizations is the strongest entity within those companies, bringing in nursing and so forth. Anyway, to summarize what happened is that out of the 2,500 people, we had about 150 involved in the first year, up to 600 the second year, up to 900 on the third year. And each year we celebrated. At the end of the year, we celebrated their achievements. And they were invested in making a change in their particular team, okay, in their particular team. And what obviously what that does is it impacts the whole organization. And we threw out all the traditional precepts around what, structure should look like and so forth. We have to maintain compliance. But at the end of the 5-year process, we ended up getting turnover from 28% down to less than 1%. Okay, and it's a tremendous savings. Savings to the hospital was somewhere in the area of $10 to $15 million over that period of time. Not only that, but the competing hospital, we had a lineup of people wanting to join this particular organization because word got out, this is the place to work. This is the place we want to be. So they not only saved money, they got almost all the employees invested in it, reduced turnover by a significant amount, and were able to create an image of this is the place to be cared for, and this is the place to work. And that required the investment of leadership. It required the investment of the nursing staff tremendously, because prior to this, the nursing staff was a separate entity. They rarely even came to meetings that leadership would hold until this new CEO was brought in. The good news is we had a new CEO to work with. He had been brand new. He didn't bring in any, baggage with him, and just had this vision. And the key thing was, as we know in OD, you have to have a vision that's clear, easily understood, and it actually becomes the foundation and the bedrock for everything that you do. So anytime we ran into challenges, went back to the vision. It was all about the vision. It was all about empowering people. We didn't call it empowerment.
Okay. I was just wondering too, what advice would you give to OD professionals today in healthcare? What is the best way for them to work with leaders and influence leaders to listen to using an OD approach?
Wow, that's a huge question, isn't it? It probably is applicable to all organizations. The first thing with leadership is understand that it's a dual leadership model, number one. You're working not only just with the CEO, who right now in 35% of the healthcare organizations happens to be an MD or a DO. Okay, so you're going to be working with a physician and maybe the president of the physician group or the physician board or the advisory board, whatever it is. You're going to be working with dual leaderships. And in almost all cases, when you're working with teams, you always have to work with a dyad, work with the clinical and the non-clinical leadership in there. You cannot, it's sort of like counseling. You can't do marriage counseling if you just do it with the husband. or just do it with the wife. You've got to have both of them in the room. And in this case, it happens to be clinical and non-clinical. So that's really a key thing. And in some cases now we're running into triad leaderships, which is medical leadership, non-medical leadership, and sort of a grassroots foundational leadership, which could be people from the ancillary areas, or in some organizations, the leadership of the union. All of them have to be at the table because that's so critical for healthcare. So that would be the first thing, know about working with dyads and triads. The other thing too, because healthcare is so intent on intensely should be and continue to be focused on the patient and the relationship of the people within the organization. I think a thing to keep in mind is something that's been done with like Duke University with the Fuqua School of Business, and they're talking about decency quotients. In leadership, we talk about an IQ and we talk about an EQ, that emotional quotient, and the IQ, the intelligence quotient. Now what I think we have to do from an OD perspective in leadership, especially in healthcare, is look at the decency quotient. And that's defined as really doing things that aren't even part of your job description. Back in my day, in the old day, they used to call it steward leadership. And now they're calling it decency quotient. In other words, it's being, and this really came to the forefront during the pandemic, during COVID, where leaders who had a high level of a decency quotient in healthcare were actually doing things that weren't required of them. They were out in the community, not because they had to be politically, but they were out in the community, making the voice heard and making sure that people understood what their hospital was about and what they were doing. So it's extending yourself. So that's a second thing, I think, from an OD perspective, working with leadership. And as you said, Nancy, listen, right? I don't care what profession you're in, listening is one of the toughest things we have to learn as a skill. And that's true listening. I mean, really listening and not interrupting, making sure we understand. And from a client entry standpoint, from an OD perspective, you've got to spend maybe more than just at 1, 2, 3, or 4 or 5 meetings to understand what that CEO is really about, or what that vice president of the department is really talking to you about, and what he or she is trying to say. I think that's probably the third thing that I would say from an OD working with leadership perspective.
Really good advice. Thank you. You know, I was wondering, how can we influence the CEO or the senior leader of the healthcare to create a systems approach to, leading change as well as developing people and have that aligned to their business system?
Yeah, I think that's probably one of our biggest challenges. First of all, we've got to be at the table. We've got to be with them at the table, working with them on the strategic initiatives. And so understanding that OD is part of that. It's not just a workshop training function. You got to be at the table with them, number one. Number two is knowing that within the construct of like a C-suite group, the CEO probably is, but not always, is the number one influencer in the organization. It could be someone else, a VP of nursing, could be a CFO, it could be the chief improvement officer, it could be a number of different things. And hopefully, and somewhere down the road, it could be the chief organization development officer or performance officers. So you got to be at the table. The other thing too is a continual challenge, because healthcare people especially are so focused on fixing what's going on right now, because there's so many fires to put out or create, is continually challenging them, taking them on and sort of taking on a coaching responsibility one-on-one, building a trust with that, let's say the CEO or this COO that you're working with, and building that trust with them so they see you as a conciliary, see you as kind of a confidant that they can actually open up to. And the trust is going to be one of the critical things there. So helping them understand the importance of what's going on, because there's so much competition in healthcare now with the acquisitions and mergers and so forth. They have to start thinking at 35, 40,000 foot level on a more strategic level, and balancing that with what happens on the daily level. And I think from an OD perspective, it's our job as counselors and coaches to help them balance those two. So thinking big picture, and that may mean getting out of their system and going to some, great workshop or seminar somewhere, maybe an IOD workshop somewhere in the can.
That sounds good. I was just going to mention, I just have to, because my husband recently had outpatient surgery at the hospital here and where I live in Fort Myers at Lee Health. And being an OD person, I'm always looking for the process to see how it's working. And I was just totally amazed at how their process worked and how people communicated with you. They cared about the customer, that they cared about the timeliness of the service delivery. Just every expectation I had was totally met. And I'm wondering, is that a movement that's occurring in the healthcare industry today?
Yeah, it is. And I love that you brought that up. Because it's a service industry. And we all know, just like you and your husband did, the minute you walk in, whether you're being greeted with a smile and accommodating, almost like a warm embrace of, we want to help you. We want to walk you down the hallway. We don't want to say, make a right-hand turn, then a left, take that next elevator. They actually will have people to walk you through the pathway of where the door is. That's critical. When I was working back in the Michigan area with a couple large systems like Beaumont and Henry Ford, they hired people from Ritz-Carlton. They hired a CEO from the Ritz-Carlton in Dearborn, Michigan, which was the highest rated Ritz-Carlton in the Midwest. And they hired him and had him become the interim CEO at the new clinic that they opened up in Birmingham, Michigan, because they understood the importance of service orientation. It's not just about the care. The doctors do the care, the nurses do the continuing care and aftercare and so forth. But that initial contact, that first impression, and the last impression when you leave, as they take you out in the wheelchair to your car, or so forth. Doing that, I call them bookends. Those bookends are powerful, and that's part of the service orientation that has to.
There's delays. There were, you didn't have to wait for anything. It was really amazing. Well, Bill, I'm really sad to say it's coming to the end of the time that we have to spend together. I want to thank you so much for sharing your experience. I can think of other topics that I'd like to talk to Dr. Bill about, and I hope that you come back again and that you share knowledge with us on the OD doctor. And if you loved this event, we do have one every month, and it's going to be next month. It's going to be on the 27th, and we are going to be talking about the latest trends in talent management with Patty Damon, our OD consultant expert in the field of talent management. So please stay tuned and look for our YouTube channel for us to publish the event in August. This event also will be published on our YouTube channel for those of you that want to maybe share it with other people. And if you did want to reach out to Dr. Bill to ask him more about OD and healthcare, please feel free to contact him. I'm just going to give you a simple email, info@instituteod.com, and we will pass on those emails to Dr. Bill. If you feel like you might be interested in learning more about our OD certification programs and our professional development, check out our website, instituteod.com. This is Dr. Nancy, thanking everyone for listening, and look forward to our next podcast. Thanks, Bill. Have a wonderful day.
Thanks, Nancy. Appreciate it.